Greetings all, I am Marsha Williams, Tushao Mainstay Wayaka Village. Mainstay Wayaka Village is one of the coastal villages across the Pomeroy Supernam region. So across my village, the health is improving, I must say, because we have recently have an extension to our health post where we have our pharmacy room or drug room, which we'll call it, and I know that the pharmacist will feel more comfortable and not be mixed with the midwife, so she can able to do her work more effectively. Additionally, we have oxygen plant there now, which we didn't have before. And additionally, from the last graduation of the nursing assistant, we have one of our very own now working along with the midwife. And we have also submitted applications for CHW to be there, and those are all persons residing within our village. So generally, the development is moving rapidly. You are seeing the changes, and I must say with the recent vouchers, most of the residents have opted in the option of taking the voucher to better check on their health care. And I realized that a lot of persons came out for the eye testing. That's for the elderly people and also the kids. And I know that a lot of them benefited from the spectacle voucher. And that's a plus because it's a great help, because some of them didn't have much to pay, some had very little to pay. And I know that's a great help because, you know, our site is very important. We do a lot. And I know that it's a plus for us.
My name is Morphy Gomez. I'm from the village of Batavia, Lower Cuyuna, Region 7. We had a lot of improvements. I am in office for 1 year. This month make 1 year. And late last year, we had the graduation of 2 new health workers, which was added to the 2 staff that was there before, a health worker and a midwife. It is 4 of them presently. And then we had the Wi-Fi installed. We had a extension, and we also are receiving monthly visit from the regional hospital with a full team, including doctor, dentist, and the pharmacist. Even so, they provide on-the-spot medication. And also, this is I see this as a big boost for our village. For the 1 year that I'm there in office, you know, I see a lot of improvements, and it is benefiting us, and not only us, the residents or people of Batavia, but also nearby companies and companies within the village. You know, they also benefit from this, from our health post service that they provide. Well, I want to say thank you to the government of Guyana and also the Ministry of Health for, you know, for this great improvement in our health system in Batavia. And I know that as time go by, we will benefit from more, because as our village expand like what the country is doing presently and, you know, developing rapidly, we would be looking forward for a change in from the health post to a health center where we can have a medics on spot because of the development that is taking place in and around our village.
My name is Wendy Francis. I am the Tushao for Kapui Lake. Well, we have tremendous development in the health sector, because a very long time ago we haven't got attendance like now, right? So we have like people going into our community, like eye specialists, like the dentists, the whole medical team. And it is very good for the community. The people are enjoying the full medical for the community, because our community sometimes, like when you go to the doctor at study, you take time. But now, most of the time, they are going for the rescue of the people. They're going in there, so we could have everything. We don't have to leave to go on the road. Only if it is an emergency, then you have to leave to go out. I would like to thank the government for his tremendous work that he is doing to the Amerindian villages, because we haven't got access to that before, and now it's coming into our community. So I would like to thank the government, and I know that it will be continuous.
I'm Ron Fredericks, Tushao Huaironi, Orbis River, Region 10. Well, quite recently the health center was upgraded. We have 3 health workers presently now, and we're doing the telemedicine presently. In my community, vouchers are being distributed and for spectacles and so forth. Yeah, I would like to encourage the government to continue investing in the health sector so that each and every person could benefit.
My name is Helen Williams. I'm the CDC chairperson of Saxacali, Essequibo Region number 3, and also the community health worker. In my village, recent developments, we had the health post was renovated. It was a bit small, so we get the extra room on it. Also, our waiting area was tiled and painted over and so on. We also get Wi-Fi for the health post. Concerning visitation, we get a monthly doctor visit from Region 3. Not only doctor, we get midwife, we get dentist, and so on. Medication-wise, it's improved tremendously. We getting enough medication. We don't fall short of them, right? Also, the region board taking supplies to us on a monthly basis. Also, at the health post, we do malaria testing. That's one for the river, and I believe that's the only health post in the river that do malaria testing. And I must say thanks to, that is from the vector control in Bartica. We get our medication, we get our treated net so that we could distribute and so on. So recently, as of last month, I believe the 14th of April, the health post received a water ambulance from the Ministry of Health, which we are very thankful for. That would aid us in transporting people to the hospital, and also when we have to go and collect any of our stuff, like when we have to collect our treated nets or medication and those things, it would really help the community and help me as a community health worker. And also, a couple mornings ago, the same month, I received back a CHW that trained since last year. So she's back in the community right now. So I have added staff at the health post. I want to say thank you very much to looking out for Region 3, Saxacali as a whole. And we are very happy for the development that is taking place in our community.
My name is Terence Domingo, and I am the Tusha of Asakata Village, Moroka Sub-Region, Region number 1. Well, so I would like to say that I'm very much pleased and satisfied because based on what I see in terms of development in the health in our community, it has been outstanding over the past few years. In the past, we would have been struggling to have modern healthcare. However, I'm happy to see that even as I speak, there are outstanding services coming to our community. For example, right in our community now, when the medical doctors have outreaches, they would do ultrasound right in the community. In the past, we would have never had that. Our youth, they have been exposed to training. Presently, we have 5 trained CSWs, and we're hoping that they can move forward even to higher levels. So I would like to say thank you very much to our government, to our president and his entire government. I must say thank you. We have seen your work and we really appreciated everything that you're doing for us, and I know that you're going to continue, and we're here to stand with you.
My name is Maylene Couchman, and I'm from the village of 47 Miles, Maburu Road. I'm a community health worker, and I'm the CDC chair of 47 Miles Village. So for us at 47 Miles, we have a health post right now, and in a health post we do have adequate drugs, that I must say, and I must compliment Minister of Health and the government of Guyana for that. We do have our telemedicine, which is very helpful, because in those areas when you have emergencies, it would take a time to get to the nearest hospital, which is Linden. And with telemedicine, you can get a doctor right there to see our patient, and they will decide if they have to do a referral to Linden or so. But most of the time, they will be treated right at the health facility and sent home, and then you will do follow-up visits and so. Because of adequate drugs and all of these things, we are able to have a healthier community, and we're happy, we're very much happy, and we must say thank you to everybody who has made this possible for us. And we are grateful for the vouchers too, the spectacle voucher, the vouchers to do the eye testing, and then you have the 15,000 vouchers that would assist in the payments, and then we have the vouchers for the HPV screening, and so we are making good use of it. Again, we are grateful for that.
Okay, I'm Ivor Portman, Middle Mass, East General Tushaw, General Village in the Middle Mass. Well, on the health, I would say that first of all, that indeed that with the health sector, that since I took as a Tushao, that I see a lot of improvement from the government side. And recently, the doctor had started a Zoom meeting with the CHWs. Them that's recently, and that's wonderful because I was a part of that also. And this making communication easier than with the Wi-Fi there. So at least the CHWs are getting frequent contact from here so that they can be on the safe side, I would say then. The testing of eyes then, which they have recently done, and this is wonderful, but basically we would like that to continue in our village from the health sector. I would just like to say thank you to the government and the Ministry of Health that what they are doing in our village, and we're looking forward as to work along with them for different ministries